Hey everybody, it's Dr. Wolff at AMC of Garner. I'm sorry if I sound a bit snuffly. I'm getting over a bug that my kids gave me, but it does provide me the perfect opportunity to talk to you guys about something that has been on the mind of a lot of our clients recently. We've received a few dozen calls over the last 1 to 2 weeks with a lot of questions from people about canine influenza, which many of you might know is currently having an outbreak in the southeast. Now, canine influenza is a lot like human flu. It's spread through the air, through secretions, and is highly contagious. Over 80% of dogs who are exposed to it will contract it. Not all of those dogs will get sick, but some of them will just be asymptomatic carriers, meaning that they're carrying the virus and can spread it to other dogs. The symptoms of the flu are a lot like in humans. It's sneezing, coughing, runny eyes, runny nose, and a fever. Sometimes, especially in older, infirmed, or young patients, that can worsen to pneumonia, require hospitalization, and can sometimes even be fatal. We've actually had, in the last few weeks, 2 deaths in North Carolina that have been confirmed cases of the flu. Most dogs will get over it just fine with symptomatic care, but some do require prolonged hospitalization. The other similarity to human flu is that there is a vaccine for it. The vaccine isn't perfect, but it does offer protection, and for those it doesn't protect, it can decrease the severity of the signs and the duration of the illness. We're recommending that vaccine for any of our patients who qualify for a Bordetella or kennel cough vaccine. Those are dogs that go to doggy daycare, grooming facilities, boarding facilities, pet stores, puppy classes, dog parks, basically anywhere where there's going to be a large group of dogs. Now, some people might say, I go to a groomer, but it's a mobile groomer that comes to my house. Well, it's still important to have your dog vaccinated. Flu can live for up to 48 hours in the environment. It can also stick to clothing, and people can be spread that way. The best rule of thumb is it's better safe than sorry. The vaccine is a series of shots, 2 weeks apart, and as long as you're up to date on your vaccine, we can do those as technician appointments. There's hardly any side effects, maybe a little lethargy, maybe a little soreness at the vaccine site, but that's it. So if you think that your dog might be a candidate for that vaccine, and if they have received kennel cough, then they probably are, let us know so we can get them in here and make an appointment for that shot. Now, the last thing to note is what happens if my dog has those symptoms. What should I do? Well, the answer to that is always call us so we can talk about it. But if we decide that your dog needs to be seen, there's some special things that we're going to want to do in light of this outbreak to keep it from spreading any further. When you show up, we're going to ask that you and your pet stay in the car, and we're going to have a technician come out to evaluate them there. And they're going to be wearing in some protective covering, a gown and gloves, and that is so that they don't get any of that potential virus on them, which they could then spread to other patients. They will then come back and report to the doctor, and if we determine that there's a high probability that your dog has been exposed or has influenza, most likely we'll continue the exam outside of the hospital so we don't risk bringing that virus into the hospital. If we determine most likely it doesn't, we can then bring them into the hospital and proceed normally. The most important point, though, is if you think your dog has the potential to be exposed, go ahead and get that shot. Like I said, it's a shot 2 to 4 weeks apart in a series, so plan ahead. If your dog's going to be boarding a month from now, you're going to want to start that vaccine series sooner rather than later. If you think your dog has been exposed or contracted the virus, don't wait, let us know. The earlier we can control those symptoms, the better chance your dog has of coming through this unscathed. And the last thing I want to remind you guys is that we're always here to answer questions. We're a phone call away, so give us a call. Myself, Dr. Zombar, or any of our staff would be happy to answer these questions. Stay safe, stay happy, stay healthy. Let us know if there's anything you need, and take care.